Great. Happy Tuesday, everybody, or any day of the week that you're watching. Um, Today's topic is empowering lung health through medication, exercise, and breath work. And today, Lori Pestano, our pulmonary nurse, and my name is Snizhana. We are going to have a great discussion and go over how to use your medication correctly, what is the best exercise for you, and really, the cherry on top of this presentation is how to use your breath work to make it happen and feel good. So just briefly, I want just kind of housekeeping things. We have people who is watching us live, which is great. Thank you so much for coming and finding an hour out of your day to listen and just really learning and care about your health. And just drop your questions in the chat. And this presentation, we will try about 45 minutes, more or less, so that we can have time for discussion, really connect and answer all your questions. So we work in outpatient cardiac and pulmonary rehabilitation. Our main job is working with lung patients weekly. So we see all type of diagnosis, all type of patients. So we have a great solid experience with patients with lung condition. And our job is to make their lung healthy. So that's why we have this topic today, really to bring this to public and help you guys have a high grade quality of life. We are going to now get to our conversation. So for the purpose of today's conversation, we are going, Lori, our nurse, is going to go over medications. And I just want to have a disclaimer, there's no conflict of interest. And you will still consult with your physician on any questions. So make some notes, take pictures of the screen, ask questions in the end if you need to, so that we can definitely help you asking correct questions, appropriate questions. But again, no conflict of interest to declare of today conversation. And we're going to start with Lori to go over our inhalers. And this is just the highlights of today's conversation. So we will go over inhalers versus nebulizers. So sometimes we see our patients be, would you say, a little kind of confused or
when to use which one, why would you use which one? And that's kind of what we're going to talk a little bit about. Why would you use an inhaler versus a nebulizer or vice versa?
And it's very important for us to understand why we are using those medications and why they make the difference, even if you don't see the difference in that specific moment or that specific day. So it just takes time and correct use of medications. And Lori will go over that today, which is very important to understand how to use them, especially rescue inhalers. So she also will go over how to do that, when to do that, how often. I will go over exercise. So we will really dive in and talk about what is the best exercise prescription for us. How does it impact your lungs, your longevity, and quality of your life? And like I said, the best part is the last one, personally breathing technique. Both of us are going to add valuable information for you guys to really use your breath, empower you to use your breath correctly so that you have all the benefits from exercise and appropriate taking of your medications. And off we go.
So like we were talking about, like Snizhana was talking about as far as inhalers. So I like this screen. You can find this from American Lung Association. If you just type in, search it for American Lung Association and just put in inhalers. This is all the inhalers that are out there, which is a lot. We're not going to talk about all of these inhalers. And we, like Snizhana said, we are not here to promote any one of them in particular. The idea here is that I want you to just kind of see what's out there. And there's different kinds of combinations of inhalers that are available. And that is a discussion that you and your physician have to have. And they have reasonings for different medicines. So if you have asthma, you might be prescribed something versus somebody who has COPD versus somebody who has like a restrictive lung disease or some other type of lung disease. But my point being is that this is just a wealth of knowledge or wealth of information here so that you can kind of see what's out there. My big takeaway all the time with this is if medications are unaffordable, then that is a conversation you need to tell your physician. So that way, look at the different varieties. You have the option then to possibly change it to something else that your insurance covers or that is more affordable. So I also would like for you to really take a look at this bottom right hand, the bottom corner. It says how-to videos. Like we said, I am not going to go into all of the different kind of inhalers or how to use all of them, but American Lung Association added this little QR code down here. So you can go on there and it will tell you how to use each different kind of inhaler. Because what good is an inhaler if you don't use it correctly? You're not going to be getting the proper medicine. It's not going to be useful. So definitely take a look at it. There's multiple different places you can find this, but like I said, this one in particular is from the American Lung Association, and you can look at that QR code to see all of the different ones.
And you can scan it live right now. We tested it, so you can scan it, save it, or screenshot it so that you have it for references.
And we said too, even if you don't get to it live, you can always go back on NKC Health patients, not the portal, but under NKC Health, and then you can type in there's classes, it says classes or resources, things like that. You can type in lung health and it should be able to get there. And this whole webinar will be saved on there, so you can always go back later and then scan it at that time as well.
Absolutely.
Anything else? All right, so like I said, the difference between inhalers and nebulizers, and basically an inhaler is going to be, it delivers your medication as a spray or a powder that is inhaled directly into your lungs. It delivers a dose in just 1 to 2 puffs. It's very compact and portable, and its effective use requires precise coordination, which makes it a little bit more difficult, right? So if you have a harder time coordinating things, that's one of the reasons your doctors may say, I don't know if an inhaler is going to be appropriate for you. But because it is so portable, it does make it very convenient. The nebulizer is going to be, it converts liquid medications into a fine mist that is inhaled through a mouthpiece. So that's the one, if you've ever been in the hospital, usually they would give you an inhaler, and we always say it's like your little peace pipe. So usually it's kind of like in a device that you're going to, has a mouthpiece, and you'll take breaths in it that way. It can take anywhere from 5 to 20 minutes per treatment. So if you're on multiple nebulizers, like I said, it could take you a little bit longer to use. It does require either an electric outlet or a battery. So some of the nebulizers now are portable. So you can just put it on battery. Some of them can even be plugged into your car. And then for people with poor coordination, younger children, or those with severe lung conditions who cannot inhale forcefully, that is one of the reasons why your doctors might prescribe a nebulizer instead of an inhaler. So real quick, when we talk about, and I'll talk about rescue inhalers and so forth, my go-to is if you have a nebulizer and you have the time, nebulizer is going to be that slow delivery of the medication. So you're going to get more of it per se than in just rescue an inhaler, in the sense of when you need it for an emergency reason or something like that. So if you have the time, using a nebulizer would be more beneficial. But if you're out and about and you're, walking in the store or you're going to do something that might be a little bit more physical for you, you might be better off just having your inhaler available then for the convenience side of that. So going to rescue inhalers or nebulizers. So it's in a class called a SABA, which is a short-acting beta-2 agonist. Basically what that means is it's a bronchodilator. The goal of a rescue inhaler is to dilate, to open up those airways so that way you're able to breathe better. So that's why we say, it's the short acting. It starts to work within 3 to 5 minutes. It peaks about 3 hours, and they'll usually prescribe it every 4 to 6 hours, and then the word is as needed. So that tends to be one of the biggest questions, is as needed. How do I know when I need to use it? So first of all, if you are going to do anything that is physical, that takes your breath away, we recommend that you use your rescue inhaler before you even go to do that activity. You want to open up your airways the best that you can, so that way you can do the task that you have at hand. The classes of them are, like I hear, so albuterol sulfate and, sorry, levalbuterol tartrate, sorry, I can't see it, are the two classes of these SABA medications. So albuterol sulfate has different forms that it comes in. So like I said, albuterol sulfate, which is the HFA, which is also a meter dose inhaler. So that's going to be your little puffer. Or it can come in a nebulizer. ProAir, Proventil, Ventolin are some of the other names. And then Zopanex is under that levalbuterol tartrate. So that Zopanex generally is prescribed for people who cannot tolerate the albuterol. So it tends to be not prescribed as often as the albuterol is. Usually people who have an increased heart rate with the albuterol, make them feel like they have palpitations or something, your physician may switch you to the Zopanex. And some people have better heart rate control with that than they do the albuterol.
So if somebody, I have a question for you. So if somebody using rescue inhaler and they say it doesn't help to me, what would you tell them?
So I would say a couple of things. One is, first of all, making sure you're using it correctly, because that tends to be one of the biggest mistakes that happens. And we're going to go over how to use the rescue inhaler. Ideally, we like for people to use a rescue inhaler or any meter dose inhaler for that matter with a spacer. We understand that the practicality of that is not always there, but you have to understand
But
that.
I will be able to get all the medication.
So using a spacer gives you such more delivery, a greater amount of delivery of the medication than without a spacer. Most men put their albuterol in their pocket. Well, you're not going to carry around a spacer with you, and so therefore it's not going to be as effective. That's number one. The other thing too is to understand that when you are short of breath, you're going to be taking shallower breaths. So when you use your rescue inhaler, you may not be getting in that full dose of your, I just keep saying albuterol, but whatever your rescue inhaler is. So really kind of focusing in on that breathing techniques, which Snizhana and I are going to talk about the pursed lip breathing again, even before you use your rescue inhaler, and then again, of course, after you use your inhaler as well. Did that answer that?
Absolutely.
Okay.
And what you're saying is it's all about prevention. So we want to stay ahead of the getting shortness of breath so that we use it correctly with more relaxed breathing, and it's going to help us if we know how to use it.
Absolutely. So big takeaway with that rescue inhaler, I want to say, and we can't stress it enough, is
without stressing you out, we want to stress it enough.
We really want you to use that preventatively. So using it before you even get so short of breath that you're like, bent over trying to catch your breath. Ideally, using it before you're going to do anything physical. We understand that sometimes you might be thinking, oh, that's no big deal. I'm not going to be short of breath during that. And then you start doing some kind of activity, and then you start noticing that you're getting more short of breath. Stop what you're doing. Take a couple of pursed lip breathing, which we're going to talk about, really working on that exhalation, and then using your rescue inhaler.
And also we want to add, it's not just even today purpose of the conversation, exercise and medications, but Lori said any type of activity. So in everyday life, intimacy, right? Any intimacy with your partner, very important. Use your medication as prescribed, right? Cleaning the house, getting outside. So we just want to make sure that you kind of have an understanding of appropriate use. That is very good. Thank you.
Okay.
Yeah.
Okay, there we go. So, like we were just saying, so we're going to talk, I'm going to pull up a video here, and this is actually same thing. This is on NKC Health website. And our pharmacists have put together how to use inhalers. So you can actually find out how to use all the inhalers on the website here as well. But I did pull from the hospital how to use a meter dose inhaler. And this is, so meter dose inhaler, not just, I mean, we're talking about rescue inhalers on this conversation today, but understanding that a meter dose inhaler could be any of them. So like your Breztri, if you're on that, or Spiriva, or Symbicort, if you're on it, whatever it might be. All right, so.
Meter dose inhaler. A meter dose inhaler is a pressurized canister of medication. To use the inhaler, first take off the cap. You will need to prime the inhaler before its first use, or if it has not been used for 2 weeks. Prime the inhaler by first shaking the inhaler around 10 to 15 times. Then press down on the canister 2 to 4 separate times away from your face until you see a mist coming out of the inhaler, ensuring to shake between sprays. Each time you use your inhaler, shake it well. Take a deep breath in and breathe out fully. Put the mouthpiece of the inhaler in your mouth and tighten your lips around it. Slightly tilt your head back. Press the canister down while inhaling deeply and slowly through the mouth. Remove the inhaler from your mouth and hold your breath for as long as you can, up to 10 seconds. Open your mouth and breathe out slowly. Wait at least 1 minute before repeating if another dose is needed, shaking your inhaler well between sprays.
Cool stuff. But the next one I want to show you is what I was talking about with a spacer. So ideally, using a spacer is the best way to use any of these meter dose inhalers. Once again, we understand that logistics and, portability and all that other stuff can play a factor. But when you use using the meter dose inhaler with a spacer, it allows that medication to float in this spacer. So that way you can actually have a better delivery of the medication. I want to say it, when I read it, the last I read on, I believe it was American Lung Association, said that by using a spacer, you're going to get literally like 80% of the medication versus not using it, where I want to say it's like a lot less than that. I don't want to put a number out there that I'm not 100% sure with, but it's a lot less. So being able to use a meter dose inhaler makes a big difference. And then I'll talk about that.
Where can I get it?
So spacers, that's a really good question, because so often, so many people that we see in our program don't have a spacer. So you can do it a couple of different ways. Whoever prescribes your inhalers, you need to ask them for a prescription for a spacer is one of the ways you can get it. And if you can't, you can also get it through, like Amazon has them, or I don't know if like CVS or Walmart or any of those other local type of pharmacies have them. I know Amazon has them.
Any specific brand I need to look at?
I would know, no, as long as it has this, it's a spacer. If you have been hospitalized and they give you a rescue inhaler while you're in the hospital, and they give it to you with a spacer, I highly recommend that you take that spacer home with you. There's different ones tell you different ways to clean them. The standard, generally speaking, is about every week you're going to rinse it out with like a little soapy water or like vinegar water. Let it air dry. You don't ever want to store it in a plastic bag. So no Ziploc bags, none of that kind of stuff, because moisture likes bacteria. So you have this thing that you're taking this breath in, and then you put it in a bag. Well, there's a good chance that it could mold or cause bacteria. So if you were to store it, either you can even leave it out on your counter. If you're carrying it with you, like in your purse or something like that, either like a cloth type of bag or even a paper bag would be sufficient enough.
Great.
Okay. But please, 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 if you are on any kind of meter dose inhaler, Breztri, especially one of those kind of things, you should have a spacer, and this will walk you through it.
Use a meter dose inhaler with a spacer. A meter dose inhaler is a pressurized canister of medication. A spacer makes it easier for patients to get the medication to their lungs. To use the inhaler, first take off the cap. You will need to prime the inhaler before its first use, or if it has not been used for 2 weeks. Prime the inhaler by first shaking the inhaler around 10 to 15 times. Then press down on the canister 2 to 4 separate times away from your face until you see mist come out of the inhaler, shaking between sprays. Each time you use your inhaler, shake it well. Insert the inhaler into the spacer with the canister in a vertical position. Hold the spacer with one hand. The other hand will be used to press the inhaler canister. Take a deep breath in and breathe out fully away from the spacer. Put the mouthpiece of the spacer in your mouth and tighten your lips around it. Slightly tilt your head back. Press the canister down once. Then, when ready, inhale deeply and slowly through your mouth. Move the mouthpiece away from your mouth and hold your breath for as long as you can, up to 10 seconds.
On your inhaler, you need to wait literally at least 1 minute between doses. And I don't mean like, oh, yeah, a couple seconds have passed. Truly, you need to wait 1 minute between doses. Okay. So I don't know if you heard. So why? Snizhana said why. So the reason being multiple reasons. One is you need to give that medication a chance to get down in your lungs. You want it to go all the way down to those little branches and those little alveoli that are in your lung. And like I said, it starts working within 3 to 5 minutes, at least your rescue inhaler. So you want to give it a chance to like kind of kick in and get like attach itself to all of those little receptors in your lungs. So therefore it'll start working. Also, if you think about the way we breathe, if you just took a big deep breath in and then exhale, you just blew out probably a lot of that medicine you just took.
$300.
A good way to think about it.
Yeah. Just blow out money, literally, out of your lungs.
Okay, now Snizhana.
All right. So that was excellent. So hopefully, if you have any questions, just drop it in the chat. There's no stupid or bad questions. So we just want to have a good discussion, or maybe it's not a question, maybe just a comment or something click, in your brain while you were listening. So, and now let's move from, so you took your medication correctly, you know how to take them to breathe better. And now let's talk about how much exercise and how often we need to engage in movement in order for us to have all the cardiovascular benefits. And when I say cardiovascular benefits, I want you to think about your heart and your lungs. So when we are moving or when we have intentional exercise or intentional movement, so basically we talk about making our heart stronger and improving our stamina and endurance, and also our lungs. So our heart and lungs work together, and through exercise and intentional movement, we're going to accomplish goal of longevity and just feeling better and have a good stamina. So and I will refer again because of our job and the kind of objective of this exercise, this presentation. We have a lot of patients who come to our program and they always say, I just want to feel better. Or they say, I just want to breathe better. What they basically saying, I want to have better stamina and I just want to have better energy. And the way how we do that is through taking medications correctly. So we're going to look at that first. And after that, we will start moving and exercising and teaching our patients how to breathe more efficient and have a proper breathing technique and correct dysfunctional breathing that we had for the, basically all our life. When we look at exercise perspective, so what I want you to think about, and it's very, very simple. So think in very simple terms. Frequency, how often I should be exercising, right? So look at the whole week. So we're not just looking day by day, like, okay, I have a whole week, or let's say today's Tuesday, and I have so many days. How often am I going to engage in exercise? Even if you're not a planner, planning for physical activity is beneficial, because if you're not a planner and you don't plan, guess what? It's not going to happen. So it's just going to be constantly thinking, or, depending on the weather and how you're breathing and what's happening in personal life. So have some planning frequency. Intensity. Intensity basically means how challenging is that for me? Because we have lung condition and it's hard for us to breathe, we think about intensity as a negative factor. We think that intensity is something painful, something uncomfortable, something we want to avoid. But when you think about intentional exercise, improving your lung capacity, improving your cardiovascular fitness, we have to apply some type of intensity. So we have to get a little bit uncomfortable in order for us to gain all those benefits. Time and frequency goes together. So when you think about how many times a week you're going to engage in exercise, I want you to think about realistically how much time you can dedicate, right? So I don't want you to think somebody said, in 1985, I have to do an hour a day. No, it's 2025. We are a little bit older. We have a busy life. We have other things to do. We just want to make sure that we look at time realistically, and our day and time of the day will be crucial too, so that it actually happens to you. You feel good and you have all the benefits. And last one, it's type. What is the best type of exercise, right? So it's not about just how, intensity and frequency, but what am I doing and what should I be doing to get all the benefits, okay? So I think about fit, and I want just briefly go over that. And what I want you to think right now while you're watching is, what are you doing now? What you used to be doing, what used to work for you and it does not work anymore, and how to make it happen. So that is all the purpose of today conversation, is getting active again and enjoy it. Statistically looking, when we look at frequency, I really don't like kind of a black and white recommendations. It's always, everything is very gray. But when we look at frequency, I want you to think about most days of the week, 2 to 3 days a week, for about 30 minutes a day or so. So 180 minutes of moderate intensity cardiovascular exercise, that's exactly what it is. It's 30 minutes most days of the week. Good start, and when we see our patients, we kind of recommend to start about 150 minutes a week. It's a little bit less. But if you can stay consistent with 100 to 150 minutes a week, you will be more successful. It's also not about frequency. It's about consistency, right? So choose amount of time, and it's always going to change. It depends how you feel. Now it's colder weather and you might be more sensitive to that. So choose amount of time and just say, hey, I'm going to do, walking or biking inside, for 20, 30 minutes most days of the week, and doing some resistance training as well. And by the end of the week, it's going to end up to, 150 to 180 minutes a week. If you have any, I have an Apple Watch, not sponsored, but that's what I have. You have an Apple Watch too. So your Apple Watch by the end of the week is going to kind of tell you how many of exercise you've done. So if you have those devices, it's actually quite beneficial for you to look at that. But again, you don't need $400 watch to tell you how active you are. So if you don't have anything like that, just kind of planning and looking at the frequency and consistency will be very important. We actually stressed out, keep saying stressed out. We don't try not to stress out anybody, but we really want, when patients come to our program, we emphasize consistency. So we want to see them twice a week, and we would like them to engage in exercise on days they're not coming. Very, very important. That's when they see the most benefits. So we know if you do that for months or so, you're going to see results. You're going to feel better. I guarantee you. Give it a try, and come back to NKC Health YouTube and just drop a link and say, hey, actually, yes, it does work, or just give us a call. We will give information in the end. Intensity. How will you monitor intensity? A couple of things. So you can do heart rate. Some machines, or again, any type of tracking devices will have a heart rate monitor. What is appropriate heart rate? that is a little bit more complex. The easiest way I am going to tell you is if you are not taking any blood pressure medications, please take 180 minus your age, and that is going to be your appropriate heart rate. If you are taking blood pressure medications, it's going to bring your heart rate down, so it's not going to be necessarily accurate heart rate. So if that is the case, with you, I want you to look at perceived exertion. I actually personally use perceived exertion scale for myself. And what it basically means when you're walking or biking or swimming or doing any type of activity, ask yourself, how hard am I exercising? How does it feel for me right now in that moment? Tune in. How is my breathing? And if your answer to yourself is, that feels somewhat challenging, you're in the right zone. You're in the right intensity. If you tell yourself, this is too hard, you need to slow down. If your answer, which is actually most, it's quite opposite. It's not that it's too hard. People say, oh, it's fine. I'm doing great. It's just delightful. It's probably too light. We want to increase a little bit of intensity. It takes time. Be patient with yourself. It's actually also fun to find, what is my intensity? Intensity is going to be different based on the day of the week, how much you slept, did you use your medication, what time of the day are you exercising, what weather is outside. So there's a lot of factor to that. So don't worry, don't freak out so that one day is different and now I'm not doing good. So it's just, again, it's going to be very, very different, regardless if you have a lung condition or not. But there's something to really learn and tune in. Sometimes I see people get frustrated with exercise. They say, I hate it. I don't like it. I don't want to do that. I used to do that. It doesn't work for me. What we would like you to do is tune out all the noise, give it a try, enjoy the movement, tune in to your health and to your breath and to your muscles, and really see, how does that feel to you? Very, very important. And that's where magic happens. That's when you get healthy, and that's when you have actually all the benefits from exercise, when you're really in it and you know what you're doing. You can do combination of things. You can do a talk test. Is it challenging for me to talk or not? If you do use oxygen or don't use oxygen, but keeping an eye on your oxygen check when needed. Please do not overcheck your oxygen. If you know that, oh, my oxygen between 90, 88 and up to 96 or something like that, that's very appropriate. Because if you're going to concentrate on only looking at your oxygen, you're going to forget, am I breathing? How are my muscles feeling? I really like that. That is such a great exercise for me. I'm doing so good for me right now. So there is a lot of component to, enjoyment of movement in general, and be intentional with that than just constantly checking oxygen. And we do this in our program. We check oxygen, but when we establish oxygen level, patients very relaxed. They know they're safe. They don't need constantly checking oxygen. One more thing about oxygen. If you feel shortness of breath, it does not mean that your oxygen is low. It means that you're exercising and you are going to feel shortness of breath. And that is normal. So you need to really tune in and understand where you need oxygen check, something abnormal, probably should not be exercising to begin with, versus I'm exercising. When I don't have any lung condition that I know of today, but when I exercise, I do feel shortness of breath and my oxygen level will drop regardless. Time, 30-45 minutes is appropriate if you go to one place and exercising, but most people find exercise is challenging and they just don't have time. So it's number one reason people are like, I don't have time. I have better things to do. I'm busy. Whenever people are doing throughout the day. So you might say, I'm going to have a breakfast. I will walk for 10 minutes. I'm going to have lunch or a snack, and I'm going to do my weights, and maybe at night to do as well. It's not just beneficial that you can fit in your exercise. It's actually fantastic for your muscles to move throughout the day. It's also great for your metabolic health and for your weight loss and for your blood sugar. I will tell you a little secret. I don't know if it's a secret, but me and Lori, when we have lunch, Regardless of the weather, we know it's good for us. We always walk for 15 minutes after lunch. So we have 30 minutes for lunch. We don't take time to eat for 30 minutes. We just inhale our food. We get outside and we get walking. So very, very beneficial. Do we want to do that? Most of the times we do not, because we have other things to do. But again, making that conscious decision on exercise, and we already decided this is something we do because we walk with people who like to walk. So that can be something that you can look at your day, just fit in. I call them snacks. So like little snack. If you have a time for a snack, like a physical snack, right? You have a snack time for exercise as well. And what type of exercise? So I gave you example of cardiovascular and strength training, but ask yourself, what do you like? What would you like to try? What did you do in the past? What did you enjoy? Do you have a knee pain? Is it a back pain, hip pain, shoulders? What type of activities you can do that feels good, empower you and your lungs and your health? So that is something that you really, and it will take time. Like I say, everything takes time. So be patient. It's a fun journey to be on and figure out. So our philosophy in our pulmonary rehabilitation, we let patients try everything. Row, walking on a treadmill in the department, different type of bikes, weights, so they know what they like, how does it feel, what they're going to do, what type of activities do they like. We also like to concentrate between cardiovascular exercise and resistance training, like doing weights or resistance bands or any type of activity that overloading your muscles, right? So we want to have kind of a combination between cardiovascular exercise and resistance training for the most benefits. Because you don't want to choose, do I want to have more stamina or do I want to be physically strong? You want to have both. You want to have a good stamina and you want to be physically strong as well. So that is very kind of I would say basic, but I think it's a solid cover on where to start and kind of think about exercise or maybe rethink that. Again, 5 minutes of movement is better than no minutes of movement. Give yourself some credit. I also see a lot of people say, well, it doesn't count. Everything counts. So just be intentional. It's better than not moving at all. So just intentionality, be mindful about it. The biggest challenge that patients face, people facing in general, they don't have to be our patient, maybe somebody they're just not patient at all, is I do not exercise because I cannot breathe. So let's go ahead and just finishing up.
Real quick, before you switch over, I know on your slide you say 3 10-minute intervals, but what about if you can't get 10 minutes? What if you can't do 10 minutes physically, or even because you're so short of breath? What do you recommend then?
I would recommend for that person to stop, to rest, and maybe do 1 to 2 minutes or 90 seconds. And all together, when they add this time, they're going to end up in your 10 minutes intervals. And I think it's also maybe sometimes not even start with exercise, but like, why can't do that? Is it my breathing? Do I feel it in my muscles? Or it's a combination of things, right? So, and I think that just correcting breathing techniques, we just want to make sure that we all getting the same live air time, camera time, the same camera time for us. So that would be very beneficial. And again, it can be maybe twice, a day, 10 minutes, twice, 15 minutes, 3-4 times 5 minutes. And again, and I said, it's not black and white, it's very gray. Make it happen for you. What works for you? Is it working for you? If your answer is yes, you're on the right track. If you tell yourself, no, I'm frustrated, I just still not seeing any results, should be aha moment for you to ask for help. And we are going to finish up with personally breathing technique. I'll let Lori to take over and we will just kind of together see
So, looks like we have about maybe 10 minutes or so. So I'm gonna this is one of the most important. I keep saying that. I know I keep saying this over and over again. Everything is important, but pursed lip breathing is the the
Foundation.
Thank you. The nuts and bolts of
Can you believe I'm
breathing.
helping you with
See,
English?
no.
I know, but
How about
I
that?
don't.
So pursed lip breathing, we say this to everybody all the time, that when we say, I want you to breathe, I don't want you panting. I want you to focus in, or we want you to really focus in on pursed lip breathing. It needs to become very intentional, and it's never just going to be natural. You're not going to just like all of a sudden just start breathing pursed lip breathing. Naturally, we generally will say we breathe. Most of us are going to breathe through our mouth, especially when we get short of breath. But that is not going to help you with your shortness of breath. It's going to make it worse. So really focusing in on pursed lip breathing is the key of managing your shortness of breath. So what do we mean by this? Just like this diagram shows, you're going to take a breath in through your nose, and you're going to exhale fully through pursed lips. This is going to be really important to do even prior to, just like I talked about, preparing your lungs for exercise or physical activity, whatever physical activity might be, going to the grocery store, walking to your mailbox, whatever that physical activity is going to be, preparing your body for that, preparing your lungs for that. So before you even get up and go start walking, I want you to really pay attention to the way you're breathing. You're going to take it in through your nose, exhaling longer than your inhalation. We don't like to put numbers on things, but if you're a number kind of person, we say breathe in for about 2 seconds, out for about 4.
Twice as long.
Twice as long. So your exhalation should be twice as long as your inhalation. So when you're doing pursed lip breathing, I don't want you to be all the way, I can't see me, bent over or any of that. I want you to really kind of be nice and tall, whether you're sitting up, standing up. Your diaphragm and your thoracic cavity, so your lungs need the room to expand. And in order to do that, you need to be upright. So nice breath in through your nose, exhale fully. And you're going to do that a couple of times before you even start any kind of physical activity. Now, like we were saying earlier, let's say you're walking and you're, I don't know, 2 minutes into your walk and you're like already starting to pant and you're finding that you're really getting short of breath. Stop what you're doing. Focus on those breathing again. In through your nose, exhaling fully. Take a couple of deep breaths. Feel yourself recover. Feel like you've caught your breath. Continue on, and so forth. And then that's how you will kind of continue to get those movements in.
Your breathing comes from your brain. So this is subconscious, like you don't tell yourself, oh, I'm up and now I need to breathe. So this is something comes to you naturally. People who actually have a lot of trouble breathing and doing activity, they already have fear and anticipation not to feel good or be already shortness of breath. And this is something you really need to work through. Like Lori said, you need to understand that, hey, I need to be ahead of the game. So just relax. It's easier to say than done. And when I say relax, what I actually mean, just you really have to check in with yourself. I'm really worried. I'm really anxious. Can I do that? Am I going too fast? So I know that it's going to be uncomfortable. I want it to be done with that. I don't want to, be in that feeling, because the more shortness of breath you are, the more uncomfortable you're going to be, because that's your body just going to tell you have to stop. Doesn't feel good, just sit down. So just acknowledge and be mindful of that is very crucial. So just think about it, relax. All you do is breathe in and walk in. Why should we breathe in our nose? Why it's not mouth? There is a multiple reasons. You actually get more oxygen, which is the goal, right? That's what you want. You want to get more oxygen to your system. And this breathing technique is for everybody. I use it as well. So you don't have to have a lung condition. It improves your stamina. So when we talk about exercise, you can walk longer when you do nasal breathing. Speed of oxygen, so how fast you get it to your muscles is faster. That's a plus too. You want that. So versus so have everything in your chest. So that is also can be very extremely beneficial. Again, in order for, I always ask my patients, what is more crucial, to take a breath in or breathe out? Breathing out, right? So because you want to really have this, not just in, and eventually you just get overwhelmed.
And to add on to what Snizhana is talking about, one of the reasons why we say exhalation is so crucial is because you have to get rid of the CO2. You have to get rid of that stale air that's in your lungs. Otherwise, you're going to have what's called air trapping or stacking. So if you think about the CO2 that's in your lungs, and then you take shorter breaths, you're not getting rid of all that CO2 that's in there. So you're not able to take a big deep breath in. Shortness of breath is related. Physiologically, it's related to like CO2 retention, keeping the CO2 stale air, as they say, in your lungs. So unless you can get it out, you're not going to be able to take a full deep breath in, which is going to create more shortness of breath.
And I want to say it does not matter what diagnosis of lung condition, cardiovascular, heart failure, deconditioning, just it really does not matter. We all have a nose and a mouth. Not all of us, maybe some people, but we all have the same anatomy and physiology, and that applies to everybody. So just give it a try. It's a practice. It's a mindful practice. The practice when you do not move or do not exercise. So when you're driving, just don't close your eyes, or sitting down, laying down, trying to fall asleep. So do it as often as you remember. Put a reminder on your phone, right? Ask your spouse to remind you to do that. So I think it's the more you practice intentional personally breathing technique, you're going to feel better and better and better. We see it all the time. We actually see our patients just 18 times. 18 times. So that's nothing. And they report, would you say 6 sessions in, the benefits?
Yep. Once they realize how to breathe and why they're breathing a certain way and how to use their medications correctly, they do. They do start feeling much better.
Their lungs don't change, so we are not changing anything physiologically. All we're changing is establishing mindful breathing and movement and taking medication, just like we said in the beginning, right? So it's all when it comes together, everything is important. And when you have fun and do all those things with joy and really see results, and you really changing your life and feel like I can enjoy, I can go out, holidays is coming up, Thanksgiving, Christmas, New Year, all of those awesome things. And you can do that and see your family and know how to breathe correctly, and have control. Just, this is so empowering. So I really love, I hope everybody loves the name of this presentation, Empower Your Lungs. But you are a CEO of your health. You're the one who is doing that, right? So, and through really personally breathing technique, you will find so many benefits. I would recommend probably also Google practice, take a picture of the screen so that you really understand, that it's a nose, breathing into your nose, really important, and just kind of go from there. We just have a couple minutes. I don't see any questions in the chat, which is fine. I always say if we don't have any questions, I bet we did such a fantastic job that people like, oh my God, they covered everything. I don't have no questions. And I love that. So hopefully that is the actually, the answer. You just don't have any questions because we were so good. We have information. So we have so 691-1575 is a direct phone number to our department. We actually have a question. I love that. I was hoping for a little question. Very informative. Thank you for great talk. Thank you, April, for coming. I love that. Thank you for coming, and finding a time, because an hour a day, that's a long time, to sit and listen to somebody talking about lungs. But we both of us hope so much it was very beneficial, and you took a little bit from each part, and just if you will just do one little change, that is going to be already great. For a great webinar. Thank you, Jim, for coming. So again, we actually have people who we know, we can't say full names, so how we know them. But again, it just speaks volume about NKCH pulmonary rehabilitation. I want to say we're one of the best leading rehabilitation in Kansas City, and nationwide as well. We are a certified program. We have exercise physiologists, which is me. We have staff of nurses like Lori, and Lori has you've done it all.
I've been a nurse for a very long time.
She's been around. She's been around.
And we have respiratory therapists.
And we have our team. So we work as a team. So when you see us, and now probably all of you wondering, how do I see those people? How do I get to this amazing program and actually have access to all of that priceless information? So what would you tell them how to do that?
So a couple of ways. Well, I think you have our phone number. You can always give us a call. We can discuss it with you, find out whatever type of lung disease. If you have a lung disease, maybe we can make some recommendations. The other thing is if you follow with whoever is in charge of your lung health, physician-wise, whether it be a pulmonologist or your primary care doctor.
And it does not have to be a pulmonologist.
Or primary care doctor, whoever manages your lungs would be the person that you can ask them for a referral to pulmonary rehab. And we are a great team that we try to make sure we check benefits and all of that other stuff beforehand and schedule.
And Lori is the one who is going to take care of that. I was not assigned to do that, and I'm very happy that I don't do that. And I also want to mention, we don't just do outpatient pulmonary rehabilitation. We also offer a maintenance program for all our patients, which should give you comfort, because after completing rehabilitation, you might love us so much that you would like to stay and continue. And again, NKC Health System, we are the only pulmonary and cardiac program that do offer maintenance. Okay. And again, that is available for everybody.
And with that said, if you happen to be on oxygen, we supply oxygen for anyone who is on oxygen. So when you are in our program, and even if you finish the program and you do our maintenance afterwards, we provide oxygen for anyone who needs oxygen.
Absolutely. Yeah. So you should feel very safe and empowered. And I think it's a great start for a good, happy, healthy life to do pulmonary rehabilitation. So it's not something that is should be a drag or just prescribed by your doctor. So a lot of people are actually asking to be in the program because they know the benefits of exercise program. I think we don't have any more questions. Is there anything else?
No, I think we are out of time.
All right. Again, thank you so much for watching and for people who joined today. I'm sorry about some technical issues. We will be definitely back. Drop in the comments. I always want to know, what can we do better? What topics do you want to know? Lung related, movement, medications, exercise. We have a lot of, we're passionate about what we do, and we have a great knowledge as well. So we would like to share that with everybody and help you to get better. Thank you so much, everybody.